Good. Good morning, ladies and gentlemen. I apologize for starting a minute or two, 3 minutes late. I am State Representative Jamie Foster. I'm the House Chair of the Veterans and Military Affairs Committee, and I am a little somber as we convene here today and talk about what services are available. I think as a committee, we've been eager to convene and talk about how we can go into the next legislative session ambitious and prepared for lots of programming and service improvements for veterans. But given the climate right now in this space, I think there's a lot of confusion in veteran communities about what the shutdown means for their benefits, what HR 1 changes might mean for their benefits. And so what we want to do today is make sure we're sort of setting the record straight and making clear to the public what can a veteran in the state of Connecticut expect right now. And get really accurate down to the minute information out to the public as widely as possible. So with that, I will refer to my Senate co-chair, Senator Honig.
Thank you, Madam Chair. I'll echo Representative Foster's words with all that's going on in Washington right now between HR 1, executive orders, the shutdown. It's a little confusing what the effects are on the ground, and that's why we're here. We're here to listen to folks who are really right involved in what's going on the ground. So thank you to the commissioner for being here. Thank you to the representatives from DSS and Department of Public Health and the veterans groups and veterans advocates who are going to be speaking here with us today. Very interested in learning how we can be most effective next year in the session to help veterans. Thank you.
Thank you, Mr. Co-Chair. Next, I'd like to invite to speak our ranking member, Senator Jeff Gordon.
Thank you, Madam Chair. I'm happy to be here. It's been a while since we've convened as a committee, so it's good to be back. We've done a lot of work this past legislative session with, I forget how many items were in both HERO Acts, but a lot of work we did. So I look forward to seeing what we can do for the upcoming session, which, as we know, is literally just around the corner. It will go by real quick before we're going to be back here in full session. I look forward to the listening session today, hearing from everybody who's here, and always welcome when we're dealing with Veterans and Military Affairs Committee, having these types of meetings and hearing things in a bipartisan, non-political manner as far as what we can do for veterans and for their families and those currently serving in the military. And as I'm always say when I'm at events in my district, first and foremost, thank those who have served, those who are serving, and their families. You're always appreciated, and I know that's the foundational sentiment and work ethic of this committee. Thank you.
Next, our ranking member from the House, Representative Mark Anderson.
Good morning. We'll be hearing from 8 speakers today, kicked off by Commissioner Welch. I expect we'll be hearing about policies at the federal level that may impact Connecticut veterans. We're also expecting a special session in a couple weeks that may include legislation to address this. We all care deeply about the veterans in this state and certainly want to have the best information available to guide our policymaking. I'm looking forward to the discussion today.
Thank you. Gentlemen, without further ado, I'd like to invite up our first speaker, which is the Connecticut Department of Veterans and Veterans Affairs Commissioner Ron Welch.
Hey, good morning, everyone. And I'd really like to thank both our co-chairs and our ranking members and the rest of the committee for the opportunity to make some remarks today. Joining me today is our Director of Advocacy and Assistance, right over here, Mr. John Carragher. If I can't answer your questions, I'm sure John can. You know, as we kick things off, our Connecticut veterans depend on both our state programs as well as the federal VA system. And we are deeply partnered with the federal VA system. The federal shutdown and now public law 11921 is definitely creating some uncertainty, right, within our veteran and military community. So my focus today is to outline what continues, what stopped, what the state can do to help our Connecticut veterans and what you can specifically expect from us at Connecticut Department of Veterans Affairs. And I will ask Mr. Carriger to pass these, what's gonna continue during the shutdown and what's not, along with our pamphlets about our programs and services. So no changes to our VA hospital. We have tremendous care available in Newington and down in West Haven. I just had a real successful surgery 2 weeks ago down in West Haven. It was a Yale doctor that came over and did the surgery. The clinics remain open, commonly referred to as the community-based outpatient clinics that are spread around the state. Very importantly, the vet centers that offer free behavioral health will remain open. The good news is monthly VA payments for disabilities, pension, education, and housing will continue. Burials and applications for markers and benefits will continue. Another very important thing is the crisis hotline is manned 24/7. And if you or anyone you know is in any kind of a crisis at all, they just need to dial 988 and hit 1. And that'll bring them to somebody that will provide some immediate response to their needs. Things that will be paused temporarily and may not continue in the form that we knew them in. A program called Peer Counseling, the Transition Assistant Program, the VA Regional Benefits Office, and GI Bill National Cemetery hotlines are closed. VA Public Affairs outreach and social media updates are paused. Cemetery maintenance and new headstone installations are delayed at national cemeteries. No change at the 2 active state of Connecticut military cemeteries. Pre-need burial applications for national cemeteries, presidential memorial certificates are not going to be produced. Federal outreach to state and local partners are currently on hold. So effects on Connecticut. Our Office of Advocacy and Assistance and Outreach are really here to help our 146,000 veterans in Connecticut. We're starting to see slight increases with the regional offices being closed and them not able to do what their normal functions. We anticipate some more clients like traditionally see as the weather gets a little bit colder. We will continue to provide excellent services through our veteran service officers. They're all out there in the 5 district offices to assist with claims and pension for service-connected injuries or illnesses. I really have to compliment this team this past year. They helped 10,000 veterans in Connecticut, resulting in about $200 million and directly going back to the veteran and their families. Housing. Housing is available on our campus, our skilled care facility for those that are in need of nursing home care. We can connect our veterans with American Job Centers spread around the state and our municipal vet rep programs. And many of you know that out of the 169 towns, we have about 120. Varied degree of expertise within those municipal vet reps, but they are out there to help make connections with the social services that are at the local level. Things like food pantries, transportation, possibly employment, how to file your 214, how to connect with us in Rocky Hill, how to connect with our Veteran Service Office, those kinds of things. We highly encourage our veteran population to connect with us. Take a look at our site. We spent a lot of time and a lot of resources last year modernizing our website. And that address, I'll repeat it twice, is www.portal.ct.gov/DVA. One more time, www.portal.ct.gov/DVA. Mr. John Carriger spent a lot of time with our BITS partner and some of our other staff last year, making sure when that site was updated, that it focused on our 4 core missions. So You go on the website and simply click on one of those mission sets and it'll provide a ton of information about the resources we have available. And those 4 core missions are a healthcare center, a residential program, Office of Advocacy, and our cemetery and memorial services. Veterans, no doubt, are facing a lot of confusion. We kind of started out that way when I opened up. And we do anticipate potentially higher demands will be placed on nonprofits and some of the local social services throughout Connecticut. Disabled veterans, depending on SNAP, and I know we have an expert that's going to address SNAP and how that affects our veterans and our residents. I won't get into that specific topic. And then career transitions and education counseling for our veterans are limited. Some recommendations that we will work on that the committee is giving us. We are doing a lot of this, but we'll dig a little deeper. Today, for example, I will be meeting with our other state health and human service partners. We meet frequently. So I will bring up some of the topics I'm addressing now with that committee. We have ongoing communication and very good coordination with many agencies supporting our veterans, especially the at-risk population. So we'll focus on that. We will continue to improve our communication to our veteran population. Right now, we're communicating through our veteran service organizations out there. We have a bi-weekly newsletter that goes out. We are sending that out to our municipal vet reps and our veteran service organizations, but we want to continue to expand that. There's some discussion about on our website doing some weekly updates. I'm sure we can work that out to let you know what's going on, how things are impacting our veteran population out there. And if anybody knows of any delays in services, if you can report them to us, we'll collect those and track those. And we really encourage our veterans, if you're struggling at all or you need answers, contact our Office of Advocacy and Assistance. We will also, I was talking to John this morning about bringing our veteran service officers back in and having a discussion with them, making sure that they're really engaging pretty closely with our municipal vet reps that are working very closely with the towns and nonprofits in the areas. So, you know, the key reassurances to everybody is that your health care right now is not affected. You're going to continue to receive quality health care at those community-based outpatient clinics and the VA hospitals in West Haven and Newington, along with your monthly benefits that you've been receiving for pension and compensation. If you can't get in touch with a federal VA office for whatever reason, and I'll say this number twice, please contact us. Our main number, 860-616-3600. That's 860-616-3600. And if you know anybody in crisis, please, it's 988 and press 1. And once again, please visit our website. Closing, I just want to say that we are here. We're dedicated 24/7 to supporting our 146,000 veterans in Connecticut. We are continuing trying to improve our programs and services to deliver really quality things to our veterans that have served and sacrificed and their families. We're closely monitoring things every day. We are networked very closely with 56 other states and territories through an organization that's been around since World War II. It's called the National Association of State Director of Veterans Affairs. We have 2 national conferences each year. We just came back from Wyoming a couple of weeks ago, and we're talking about all the bigger issues that affect everybody across the nation. We also, what I will say about that group is these are very seasoned folks. They're very senior. Most of them have had an entire career in and around the military or social services. Many are attorneys, many are medical professionals, many are retired admirals and generals. And we can very quickly see through things when they're not going well. And nobody is afraid to comment or or push back very hard when we feel like our veterans aren't being taken care of. That gives me a lot of confidence to sit in front of you today, to say that we will get through this. There's definitely going to be some hiccups and some struggles, but we stand ready to help any way that we can. So we're happy to take your questions now. And I will ask John to pass around these pamphlets also. And these have all of our programs and services. Yeah.
Thank you, Commissioner Welch, for joining us. I want to first say that I feel comforted in your staff's willingness to sort of lean in this moment and make sure that if people are navigating challenges about whether or not they can get something that they feel like they're due, that you can help them navigate that process. I was wondering if you could clarify the VSOs right now. If someone calls their VSO and they have a question about benefits, is that a good referral source for them to be getting other services that they might need? If they're looking at their municipal vet rep, can you sort of just tell us if let's say a veteran is struggling with needing a benefit that they had previously been getting and they're getting sort of they're not sure how to navigate that process. Like, is the Office of Advocacy and Assistance the place for them to go to help navigate those systems? Can you explain to us the sort of scope of that work?
So in the perfect world, if we could start local, right? If that municipal vet rep is helpful to them, and if the municipal vet rep's not helpful, again, there's some are extremely experienced, very knowledgeable, and others are they've just accepted that voluntary position. So we don't want anybody to get frustrated. If they can't answer the question, bump up to the Veteran Service Officer in one of the 5 district offices, and then they can absolutely immediately come over to, that's another avenue, is just come direct to our Office of Advocacy and Assistance.
I appreciate you sharing that. I think I just want to make sure veterans know that as you're struggling these processes, we don't want you to, like, if you're calling and you're not getting an answer somewhere and you might feel like you might be calling down the wrong route, that the Office of Advocacy and Assistance and the municipal vet rep programs want to help. And if we need to, as a committee, be offering more resources, we want to know that. So we want to know if they're feeling overwhelmed, if they're getting too many calls, we want to know so we can send more resources. This last session, we bolstered that office and added a significant number of positions. And so we do anticipate that they're going to be used and needed in this moment in time. And so thank you for offering to help folks in need and sort of standing up in this moment. Any other questions from my colleagues? Okay, Senator Gordon.
Thank you, Madam Chair, and Commissioner, thank you for the work you do. I know you're out and about all over the place, and thank you for the work your team does. As a doctor, I do take care of vets, and I think it's very important for veterans and their families to know and be reminded that the medical services are still being provided. It's not as if they're just out there. I've had a number of my own patients ask, if they'll continue to get their care, and I said, absolutely, there's nothing slowing that down or shutting that down. So that's very important for them to know, because as you know, a lot of veterans, especially as they're aging, need a lot of services, medical services. So that's an important point to highlight, and thank you for doing that. And I also just want to say thank you for your department being available to veterans at any time, just not now, who have questions or may not know how to navigate a system. I know my office and myself, when I'm out in the community, I hear from veterans and I refer them to your department. And I know they do get the help that they need to help navigate things and see what can be done. So that's something that's always needed, just not now. But I'm glad that you're highlighting that point so that veterans know that they can reach out to your department when they have questions, concerns, no matter the circumstances, and be helped. So thank you for doing that. And I echo what Chairwoman Foster said, that we've done a lot to be of help to your department, and of course, by extension, help to veterans and their families. And anything more that we can do within the bounds of limitations that we have as a legislature, always happy to hear. Can be small, can be big. I know you're never shy letting us know what needs the department has and the veterans have. So always there's an open door for us to hear from you and your department. So thank you for continuing to work with us the way that you do. It's appreciated.
Thank you very much. And, one thing I would like to also mention, community care. One thing that the federal VA has reassured us is if there is an availability within 28 days, especially within a specialty, that community care is going to get authorized. It just happened to me recently, and I couldn't believe it. Within about 48 hours from being at a visit, I got a call from a provider saying, hey, we have these 3 dates. When would you like to come? I was like shocked. I never anticipated that to happen. But going back to Representative Foster, very important. Somebody's on the other end of the phone when somebody's in crisis, right, and needs help with an issue. There's nothing more frustrating. And I would argue that that does and has led to suicides over the years, over the last couple decades, when somebody's just been transferred all over multiple systems, and they just get frustrated because they're in crisis, right? And they're at the bottom of the well and they just don't know what to do or where to go.
And the veteran-specific option for the suicide prevention hotline is still active and still working, and that's 988 and option 1,
Yes.
correct? Okay, thank you. Next, my co-chair, Senator Honig.
Thank you, Madam Chair. And thank you, Commissioner Welch, for being here and providing us, all that information about what is and what is not affected. In your remarks, you mentioned that VA benefits regional offices are closed during the shutdown. Can you talk about, is there any interaction between our state VSOs and these regional offices and how that closure affects them? You want to address that?
Good morning, Senator, members of the committee. John Carragher, I'm the manager of the Office of Advocacy and Assistance. And yes, we maintain a very close relationship with the VA regional office. We're lucky we have one. It's called the Hartford office because it used to be over in the federal building in Hartford. It's currently in Newington. That office, from a public intake perspective, is currently closed. And what does that mean? That means that for lack of a better word, service officers that would take intake claims for disability claims, et cetera, are no longer there. So what has that meant? That has meant a couple of things. One, it's increased the load on our service officers within the department, as well as the accredited service officers from the various veteran service organizations. So are claims still being processed and paid? Yes. But the options for veterans to get assistance in processing those claims has been reduced. I hope that answered your question.
Yes, thank you.
Thank you, sir.
Thank you very much. Next, Ranking Member Representative Mark Anderson.
Thank you. Thanks for coming today, Commissioner. I got a question. Part of it is for the military, so you may defer, and part is for veterans. So I know of at least 2 ID cards you need to access healthcare. For maybe a retiree, it might be the DoD card to access TRICARE for life. And then the Veterans Health Identification Card, which might be issued at VA facilities. I have one report that might be suspended, both of those. So are there people who have expired cards who cannot get one and might be denied care?
So, sir, thank you very much for the question. And the Veterans Enrollment, Veterans Health Identification Card is issued by the federal VA. And just a reminder that the federal VA provides direct care, not insurance. And that's an important thing to remember. As long as the individual is enrolled in VA healthcare, they don't necessarily have to have a VA health enrollment card. I have not heard of them suspending or stopping that process of issuing those cards, but it is something that I can find out for you. I don't know.
Thank you. And this may be the military department who aren't on the list today, but like the DoD card, it seems like those might be closed. I had one report of that They might be non-essential who are issuing those. but-
I don't know if the Deere's offices are closed. That would, like I said, it'd be a question for the military department.
Thank you.
Thank you, sir.
The next person on the list is the Vice Chair of the committee, Hubert Delaney.
Thank you, Madam Chair. Commissioner Sergeant Major Carragher, it's always great to see you. Thank you for being here today.
Thank you.
Few quick questions. You had mentioned first about the increased load to our veteran service officers. We'll be able to get us, preferably either closer to the special session or closer to, the short session coming up, the exact numbers of how the increased load and recommendations on whether or not that's going to be impacting their ability to provide the services to our veterans.
We can start to track that. John, any issues? Yeah. We'll make sure we track that part of it.
Thank you. Yes, sir, Commissioner. Yeah, that's very important information. I'm sure the committee would love to be able to see that, to be able to figure out how to best get our people what they need. Second, you mentioned a couple programs that are potentially going to be affected by the federal spending. Do any of those programs, to the best of your ability, have any matching state funds going to them at all?
I don't believe anything that I mentioned.
Roger that. Thank you, Commissioner. And then lastly, for your presentation, it was a lot of phenomenal information on the priceless and often uncelebrated work that you and your incredible team do. Will you be able to get that presentation or some of the information that you gave to us today to some of the members of the committee?
Sure, absolutely. We can definitely forward that to you. Not a problem. And we'll include some of it in our bi-weekly newsletter, those things that are really essential and pertinent. We'll kick those out.
Thank you, Commissioner, and Sergeant Major Carragher, for all the work you do. Thank you.
Thank you, Commissioner Welch. Next up is Representative Anthony Nolan.
Thank you, Madam Chair. Commissioner, thank you so much for the Herculean work that you and your team put in to make sure that our veterans are cared for and taken care of. It is honorable, and it is something that we owe our veterans. And it, unfortunately, as much as I don't want to say, but it frustrates me how Washington is impeding on services that are going to be beneficial for our veterans. And I must say that it is actually frustrating to know that they're impeding so much that we have to take services away from veterans who we don't give enough services to. And I just don't see how our president and our party that is in power can allow this to happen when we see monies going to other areas that are friendlies for them. It's just irritating to know that they're able to make sure that our veterans are taken care of and they're choosing not to. But I wanted to thank you for the things that you're doing. And Vice Chair Delaney talked about the tracking the increased load. I think that would be very beneficial for us to get, and especially if you can share with us, because of the federal government, where you're falling short financially and how much you're falling short financially, so that we can know the amounts that you will be lacking because of Washington doing nothing in the areas that our veterans will be unable to get services. I think that would be important for us, especially since we are going into a special session, with the hope that we can push to make sure that our leadership here in Connecticut knows the areas clearly, in case we are able to push for some funding to help close that gap. Thank you, sir.
Thank you.
Thank you, Madam Chair.
Thank you. I don't see any other questions from the committee. Commissioner, is there anything else that we should be asking about that we may have missed that you feel like the public should know? All right, seeing no other comments, thank you so much, sir, for joining us today. I appreciate it. The next speaker on the agenda is the Connecticut Department of Public Health, and I believe Marcia Pesolano is joining us today.
Hi, good afternoon, or good morning, everyone. Thank you for the opportunity to be here.
Thank you for joining us. You may proceed.
Thank you. So as Representative Foster said, I'm Marcia Pesolano. I'm a Public Health Services Manager and the State WIC Director for the Connecticut Department of Public Health. I thought it would be ideal to share a little bit of information about WIC in case folks aren't familiar. So we are a federally funded nutrition program sponsored by the U.S. Department of Agriculture and operated by DPH in Connecticut. We serve pregnant, postpartum, and breastfeeding women, infants, and children up to age 5 that are at or below 185% of the federal poverty level, are a Connecticut resident, and are at nutritional risk. And although most people are familiar with the nutritious food and formula benefits that the program offers, WIC really is more than that. We provide nutrition assessment and tailored education to help families live healthier lives. We provide breastfeeding education and support, and we refer our families to healthcare and social services programs to ensure that all our participants have access to the services and resources in their community that can support them. We're currently serving about 53,000 participants, which is about a 20% increase since 2020, when we were serving just under 44,000 participants. And we're really thrilled that we have been able to expand services to so many families. We're currently supporting military families in the eastern part of the state by providing services at the Thames Valley Council for Community Action, or TVCCA WIC program, in their Norwich and New London sites. The New London site also operates a satellite site in Groton at Groton Human Services from 9 a.m. to 4 p.m. on the first and third Thursdays of every month except in December. And of course, during this time of uncertainty, I wanted to talk about the impact of the federal shutdown. Luckily, the Connecticut WIC program is currently operating as usual. WIC participants should continue to attend their scheduled appointments and use their WIC card as usual. We are monitoring the situation very carefully and will update participants and partners of any changes to the program status while the shutdown continues. So I encourage any military members or veterans who might be eligible, or be the parent or caregiver for a child that may be eligible but are not yet enrolled, to reach out to us. The easiest way to find information on the program is to visit the DPH website and look for WIC, or simply search for Connecticut WIC in your favorite browser.
Thank you so much. I think a lot of people are probably thinking, why is WIC in a military affairs public hearing? But some of you may not know, but my background is that I'm a registered dietitian with a PhD in nutrition. And during my master's work, I was working with fathers with young children. And as it turns out, on the base in Groton, there turns out to be a Head Start or near the base in Groton, a Head Start and a WIC office. And a good proportion of the families that are served are actually E1, E2 members who meet the income qualifications for WIC. And so there are active duty folks in our state in those first two pay brackets who may be eligible for this program. And it is continuing on in Connecticut currently, but their families might be benefiting from this program. And that's a significant benefit to children and their families. And I think it's just important to highlight that it is something that's affecting military families, even though we might not traditionally think about them being eligible. And so I'm just curious if there's been any, if we're hearing anything, particularly in the Groton, New London area, State Director Pesolano, that you might be able to tell us about how things are working down there, if there's been any increase. Are you taking new applications for families that are applying? And what about folks whose salaries are affected during the shutdown? Is there temporary access that they might be eligible for?
Sure. So Let me start with your question about accepting new participants. Yes, we are continuing to operate business as usual and are serving clients that are interested but not yet enrolled. So again, encouraging anybody who could be eligible or thinks they might be eligible to reach out. And like I said, our information on our website is the easiest way to find the information about that eastern part of the state TVCCA location, especially that Groton satellite site that's available. We have been getting increased calls with questions about the status of WIC, and been telling people the same thing that I've told you here, that we're operating business as usual, continue to keep your appointments and go to the store, use your benefits. And then I'm sorry, please repeat your last question for me.
What about folks who have a temporary decrease in their salary due to the shutdown and they have young children that they're feeding?
Sure. So we have provided guidance to our local agencies that serve and provide direct services within the communities about how to, serve those folks when they have a temporary loss of funding or a pay.
So that means, just so we're explicitly clear, if there are families who are eligible for these services or struggling, they're not traditionally eligible for these services, but are struggling right now, that those folks should reach out to their local social service organizations, including their local WIC office, and they would have more appropriate guidance about whether or not they would be eligible for additional services that they might not typically get.
Correct. I'd have them reach out so that they can clarify if they're eligible at this point.
Okay, thank you so much for joining us today. Any other questions from members of the committee? Senator Gordon.
Thank you for the presentation. I know you talked about Eastern Connecticut, which, as you know, geographically is big, and I represent parts of Northeast Connecticut. I'm just interested as far as the services up there. I know there have been services out of Putnam and out of Willimantic, and I'm just interested as far as covering that part of the state that's still operating, because I know some people who need these services are not necessarily going to travel down to Norwich or down to Southeast Connecticut. So I'm just interested in that. Anticipating there might be more calls that we might receive up in that part of the state from constituents wondering about, operations of the services and things like that, given there's a lot of confusion, a lot of anxiety out there.
Sure. So all of our locations are operating across the state. We have 9 local agency contractors that provide those direct services and 22 full-time sites that cover all 169 towns. They are all operational. And in Putnam and Willimantic, we still have those 2 full-time sites available. They're operated by Day Kimball Hospital, and more information can be found on our website on how to reach them.
Thank you, Senator Gordon. Representative Gajewski.
Thank you, Madam Chair. Thank you for coming today, Director. My quick question, I represent the subbase in Groton in southeastern Connecticut. And there's been a little bit of increased need in our area. My question was, I was wondering what percentage of need, what increase in percentage of applicants have you seen and then granted through that as well?
I don't have specific numbers on increased need because, we have an influx of people coming in on the program. So I can't speak to the actual percentage increase, but I can report that I've heard that there have been some increased calls coming in, especially in that TVCCA, those 2 locations in Norwich and New London. So we have received increased calls, but I can't speak to whether or not they're specific to military members or veterans or just other people seeking services at this point.
Thank you for that. I know in my region especially, we've seen an increased ask as well, regardless of military or non-military. So I thank you for that answer. And Madam Chair, I'm all good. Thank you.
Thank you. Next, Representative Nolan.
Thank you, Madam Chair. Can you just give a few examples of some of the increased calls that you're getting in so members can have an understanding of the topics that are coming into the center?
Yeah, so some of the calls that we're getting are whether or not WIC is still operational. I think there's There are some states in the nation that are in a different position than we are in Connecticut, so there's some confusion around messaging. We also have been receiving increased calls because of the SNAP announcements. There's some confusion between the difference in SNAP benefits and WIC benefits. So we are trying to clarify for our participants that WIC is still operational and that they're, even though the SNAP benefits may be impacted, WIC benefits are not currently impacted. So that's really what we're seeing in the past couple of, weeks.
Okay, and if you could send any information that you're putting out that we might not catch to the administrator, so the administrator can send it to members so we can help put out information that you're sharing. I appreciate that. Thank you, Madam Chair.
Certainly.
Thank you. I want to just say something sort of in response to Marcia just speaking today, our Director Pesolano, I'm so sorry, that this area, the sort of food insecurity, hunger space right now is in a pressure point, a pressure cooker situation. And so a lot of families that are eligible for WIC might be getting SNAP and decide not to get WIC, even though WIC is the best public health intervention we have for families who have low incomes and low budgets. So I anticipate that they will see an increase of people who are eligible but historically not enrolling, because SNAP offers a lot more flexibility than the WIC program does. And I think a lot of families get SNAP and opt, if they can get by without it, to not enroll in WIC. And so I anticipate that they will see a big influx in services that they're needing to offer. And I want to just point out in this anti-hunger sort of space right now that WIC and SNAP offer people the opportunity to shop at grocery stores and purchase for their families the foods that they want and desire, and will prepare and tend to be healthier. We do have an emergency food system that families who are struggling because they have a short-term lapse in their, hopefully short-term lapse in their incomes, they can go to a food bank and a food pantry, and there's been efforts made to bolster those systems. But yesterday I saw folks disseminating information that like the food bank food pantry system serves about 1/10 of the emergency food that our state sees compared. I have always seen that it's somewhere between 1/12 and 1/15 of the total emergency food supply system. So when you see the typically food insecure population, folks who have lower incomes, have young families, and are struggling to make ends meet, those folks are in this system. Nothing has changed. Maybe their incomes have gotten lower. Then we also have all these folks who just haven't really saved a lot, which is most Americans. And then we have a shutdown pausing their income, which is folks in the veterans and military affairs space right now. And so we're going to see an influx of places where people are needing emergency food systems. So I anticipate an area like Groton, New London, which is served by a food bank. I'll just get this on my record for my colleagues that down on the other side. They're served by a food bank that wasn't even served in the $3 million yesterday. So they're served by the Gemma Moran United Way Food Bank, not Connecticut Food Share. And so they're going to see this huge increase, and they're going to be people going to food banks and food pantries saying like, this isn't enough. This isn't the kind and quality of food that I want to feed my family. And it's going to be folks who have struggled for a while with food insecurity, and people who never expected themselves to be in this situation. And so 60-70% of the population is like one unexpected financial loss away from struggling, because people don't have huge amounts of savings. That's just not the economy that we live in. And so I expect that those areas are going to see need. So this is my Dr. Jamie Foster, PhD in nutrition hat, and someone can correct me if they believe I'm wrong. But I think that folks who are watching this and saying like, oh, I didn't know that area might have increased need. What can I do? They're going to think, oh, I'm going to just like go through my pantry and donate some cans to the food bank and food pantry. That's very nice and very generous. Kudos. Get gift cards to local grocery stores, to the food banks and food pantries that need them. Folks need to be able to purchase food. And if you just get like what's overrun from your own food pantry, it will never be enough to fill the hole that people are going to find themselves in right now. So if you're in a position to be generous and give philanthropically, donate to your local food banks and pantries, not just in what's left left over in your pantry, but donate in a way that allows families to feed their kids. And often a very needed thing for families with young children is snack foods as they're packing lunches. Hopefully families are leaning on their school lunch programs in this moment right now to help make the small dollars that they have last longer. But I just want to point out, send your local food banks and food pantries gift cards to disseminate, your local social service organizations, if you're in a position to give generously. That's my recommendation. And then Marcia, thank you. Director Pesolano, thank you so much for joining us and being here today. I think a lot of my colleagues were thinking, what on earth is she doing? But as you can see now, there is a reason and there's a method to this madness. So thank you for your organization's work and service and to the important work that WIC always does. And thank you for standing in the gap in this moment.
Thank you so much for having me.
Anyone else? Good. Okay, wonderful. Thank you so much. The next group on the agenda are social services from the Department of Social Services, and we have the Deputy Commissioner Peter Hadler and the Program Director of SNAP, Dan Giacomi. Thank you for joining us, gentlemen.
Good morning, and thank you, Representative Foster and Senator Hoden and members of the Veterans and Military Affairs Committee. My name is Peter Hadler. I'm a Deputy Commissioner at the Connecticut Department of Social Services and happy to be here to share information about the impact of the federal shutdown on the programs that DSS administers, as well as some information about changes that impact veterans and other members of our residents of our state related to HR 1, or the One Big Beautiful Bill Act, as it's also called. We will briefly go through the latest status updates for the SNAP program, because this is where the greatest change is coming related to the federal shutdown. And then I'm going to turn it over to Dan, and he can help us walk through some of the changes that are sort of more long-term and durable coming out of the federal law, including with a special focus on those elements of the law that affect the veterans within the state. So I do want to just very quickly note that we are focusing on SNAP because the other programs that DSS administers are not as impacted by the federal shutdown at this time. Medicaid and Husky continue to operate normally. Our cash assistance programs are functional and available. Our offices are open and continuing to process applications, renewals, and changes for all of our programs. However, there are some very significant changes afoot, as has been referenced earlier today about the SNAP program. And I'd like to walk through briefly a timeline of some of the changes so that everyone has a sort of understanding of where we have been this month and where we are as of today related to SNAP within the federal shutdown. And I believe there's a presentation that is popping up behind me. So very preliminarily, obviously, we're going to cover both shutdown and HR 1. And if we can move to the next slide, I can talk a little bit about the SNAP changes. So when we first received information from the federal government right around the beginning of October, they advised us that SNAP benefits would continue to be available and functional as normal during the month of October. And this has been the case. So SNAP is still being issued and is being used by our residents around the state during this month. However, on October 10th, the FNS, which is the Food and Nutrition Services, a branch within the U.S. Department of Agriculture, and our federal partners in administration of the SNAP program, advised all the states around the country that there would be insufficient funds to pay November SNAP benefits in full, and indicated that prior issued benefits may not be available. This was because there was a possibility of the retail network being taken down so that EBT cards would not work. That has changed. I do want to clarify that, and I will be very clear about that in the subsequent points here. So we began communicating last week with all of our partner stakeholders and clients around the state to emphasize the message that we had as of October 10th. We are now changing that message slightly because we received updated guidance on Friday at 8 p.m. that clarified 2 points. One, the federal government has made very clear that they are suspending November SNAP benefit issuances and that there will be no new November SNAP benefits for any households across the country. And this is very important. Obviously, we serve approximately 360,000 individuals around the state. Almost 1 in 10 state residents are beneficiaries of the SNAP program. The amount of funding that the federal government provides is approximately $72 million a month in SNAP benefits. SNAP benefits are entirely federally funded and federally controlled. So it is really within the purview and prerogative of the federal government to make this determination, though I think some folks disagree about whether there actually are some funds available, but that is not the position that the administration has advised us. And they have also stated very specifically that states will not be reimbursed for any state funds that are issued in lieu of the federal absence of funds. So we are here to make sure that everyone understands that there will be no November SNAP benefits unless there is some late-breaking change in guidance. I think actually if we can go to the next slide, we can clarify that. However, all SNAP benefits that may be on a card already, if a family was able to preserve some of their benefits during this month or from a prior month, will continue to be accessible in November and ongoing. The EBT card retail network will be functioning. However, there will be no new benefits for November. I also do want to highlight, because it's a question that we have received, because EBT cards also are the vehicle by which cash benefits are also issued to families, that there is no interruption to the cash assistance programs at the state level. This includes TFA, or the Temporary Family Assistance Program, SAGA, State Supplement, and Refugee Cash Assistance. Those programs will continue to operate. Funds will be made available in November, and EBT cards will be usable for cash programs as well. So that brings me to the end of the key points related to shutdown. And I know we have a very crowded agenda. We did want to move through and talk about some of the changes that are related to H.R. 1, or the One Big Beautiful Bill Act. These changes impact residents across the state of many different sort of categories and groups, including veterans very specifically within both the SNAP and Medicaid program. Dan Giacomi, who is our Director of Program Oversight and Grant Administration at DSS, and our long-term SNAP Director, will help to walk through some of those changes, and then we'll be happy to take some questions at the end.
Thank you, Deputy Commissioner. Good morning, everyone. As you noted, my name is Dan Giacomi. I'm the Director of Program Oversight and Grant Administration at DSS. I also serve as the State SNAP Director. As the Deputy Commissioner noted, my portion of today's presentation will focus on the SNAP-related changes resulting from H.R. 1, also known as the One Big Beautiful Bill Act. Specifically, two of the changes that I'm going to note today and that I'm going to discuss are SNAP work requirements for what are considered able-bodied adults without dependents, or you'll often hear them referred to as ABODs. This is a category of individuals within a subcategory of a general work requirements that all SNAP recipients have to adhere to. Currently speaking, and we'll get into in a little bit, these are individuals between the ages of 18 and what will now be 65 years old. The second we're going to refer to as SNAP eligibility changes for certain non-citizens. Then I'll turn it back to the Deputy Commissioner, and he'll reference and go over similar changes that are going to be faced, not as immediately, but in the near future to our Medicaid population. Next slide, please. Specific to SNAP changes for certain non-citizens, you'll see on the left side of the presentation our current state. Many classifications of non-citizens can qualify for SNAP, including lawful permanent residents, Cuban Haitian entrants, what are considered COFA citizens or compacts of free association, which are citizens originally from the Pacific Islands of Micronesia, the Marshall Islands, and the Republic of Palau, who lawfully reside in the United States, as well as refugees, asylees, parolees, victims of trafficking, victims of domestic violence, and specific to individuals working or previously that worked with the United States government, and many of the veterans that we serve, which are Afghan and Iraqi special immigrants, or SIVs. Effective November, when we hope to implement this, but really taking effect with the passage of H.R. 1, which was signed on July 4th. The individuals that you see in the orange highlights on the deck itself, which are the refugees, asylees, parolees, victims of trafficking and domestic violence, and Afghan and Iraqi SIVs, will no longer be eligible to receive SNAP benefits. What we do know is that some of these groups of individuals have transitioned to other categories of non-citizen status, specifically lawful permanent residents. For example, refugees and asylees, after 1 year of lawfully residing within the United States, can petition to become lawful permanent residents. So what DSS has been doing in preparation is reviewing all of the non-citizens within our eligibility system to determine whether or not they maintain in the category that we currently have them identified, or if they have switched to a new category, so that once our system changes take effect, we are not incorrectly denying or closing benefits for individuals that are considered to be still eligible. But what we do believe is that there are approximately 3,000 individuals right now receiving SNAP benefits that are listed in the categories of individuals that will no longer be able to receive assistance once these changes are implemented. Next slide, please. The second, as I briefly mentioned, is our ABOD, or able-bodied adults without dependents work requirements. Current state is individuals 19 through their 54th year of age have to show to DSS that they are engaged in at least 80 hours per month of work or community engagement. We look at community engagement as job training programs or volunteer work that they can be engaged in, that they have to prove in order to continue receiving SNAP benefits for more than 3 months out of every 36-month period. The 36-month period starts from the month that they apply and then goes out an additional 35 months. Unless they show to us that they are meeting these work requirements or identify as having a specific exemption, they would only receive SNAP benefits for 3 months, and then they would no longer be able to receive unless they came back to the department and showed us that they were then meeting the requirements or had an exemption where they could then begin receiving benefits again. Under the current state, we were able to exempt individuals that lived in a household with a child under the age of 18, hence that without dependent kind of notation of the category itself. What you'll see is that when the changes again are made, the HR1 reduced the age of the children that would allow an individual to be exempt to under age 14. So that means now households with children between ages 14 and 18 will no longer have that exemption, and again would have to show us that they're meeting the work requirements. It also specifically exempted individuals that were identified as veterans, those experiencing homelessness, and those that were in the foster care system that are currently under the age of 24. In the next slide, I will kind of go over what the federal government defined a veteran as for the purposes of ABOD work requirements, because we do understand that it is a little bit more expansive than perhaps the commonly accepted definition of veterans. However, what it allowed us to do was exempt more individuals that served the federal government and served in the military to be exempt from the work requirements. You know, as I say on the right side of the screen, it specifically removes those exemptions as a result of HR1. And the final one, and one of the largest categories of exemptions that we did have, is it allowed waivers for certain towns or cities within the state to be exempt from the work requirements if the state could prove that that area lacked sufficient jobs. The way that we were able to do that is we would compare that town or city's unemployment rate for a 24-month period, and we would know if the unemployment rate for that same period was at least 20% higher than the national average. We could make the argument that that town or city or area lacked sufficient jobs. They have now removed that ability for us to make that determination based upon our own state's situation, and specified that only towns or areas that have an unemployment rate greater than 10% can be waived from the ABOD work requirements. As a matter of practicality, the last time we looked at the nationwide data, there were only 10 counties in the entire United States that had an unemployment rate greater than 10%. None of them are located within the borders of the state of Connecticut. So what that effectively means is that all of our towns and cities, including some that have been exempt for a number of years, will no longer be able to have that exemption. Next slide, please. As I noted earlier with the definition of veteran solely for the purposes of the ABOD exemptions, a veteran was identified as an individual who, regardless of the conditions of their discharge or release from, served in the United States Armed Forces, including an individual who served in a reserve component of the armed forces or served as a commissioned officer of the Public Health Service, Environmental Scientific Services Administration, or the National Oceanic and Atmospheric Administration. We did review our system and we noted there were approximately 5,000 individuals that were listed as veterans in Connecticut that benefited from this veteran exemption to the work requirements. As I previously noted, these veterans may still qualify for an exemption, but however, it would not be based solely upon their veteran status. There are still some exemptions that are available to individuals. For example, if an individual is receiving VA disability payments, regardless of the percent identified as disabled, that individual would still qualify to be exempt from the ABOD work requirements, similar to an individual receiving SSI or SSDI benefits, or an individual that is identified by a medical professional as being physically or mentally unable to work. And if you go to the next slide, I actually stepped into that slide as I was speaking. This does show some of the exemptions that will remain for our ABOD population going forward. I mentioned the first ones already, the veterans benefits regardless of rating, physically and mentally unable to work. Others having applied for receiving unemployment, going to school, college, or a training program at least half-time, though I will note that students specifically have kind of more stringent rules as to how they can qualify for SNAP benefits that they would have to meet regardless of the ABOD work requirements. There are also exemptions for those that are participating in a drug or alcohol treatment and rehabilitation program, those already meeting work requirements for SNAP and or TFA, a parent caregiver of an individual with a disability or those that cannot care for themselves, and certain Native American populations. And I will note that the department has put forward a online sort of pre-screener that individuals can go to at www.ct.gov/SNAP/ABOD, ABAWD. Individuals can go there. It will ask them questions as to different exemptions to see if they qualify. If they do identify as having an exemption, it will provide them with the next steps and some accepted documentations that they could provide to the agency. If they do not qualify, it will provide information as to where they can go for food resources, such as Connecticut Food Share or 211, as well as allows them the ability to enter their town to find their local community action agency that can help them with submitting paperwork or finding resources within their area. Next slide, please. The final slide, this kind of talks to that town exemption that I was speaking of earlier. When you look at the current town exemption, as well as all of the other exemptions that we identified that will no longer be available, we expect that there will be around 36,000 current SNAP recipients that are at risk of losing benefits because of the new work requirements. On the right side of the screen, you'll kind of see a breakdown based upon towns and cities that kind of shows that while situated or kind of heavily focused on the center of the town of the state where we have our largest cities and populations, there are almost no towns or cities in the state of Connecticut that will not be affected by this change and will not see at least a small reduction in number of recipients eligible to receive SNAP benefits. And I'm going to now pass it to DC Hadler to walk through some of the Medicaid work requirements and other changes.
Thank you, Dan, and I'll move through these fairly quickly. The slides are obviously available to everyone, and we'll take some questions as soon as I move through them. So the Medicaid work requirements are coming a little bit further down the timeline. These SNAP changes are occurring right now. They are going into effect in the month of November. The town exemption waiver will start impacting individuals in the month of December. But a number of the items that I'm going to review on the Medicaid side don't take place until later in 2026 or 2027, and some changes don't take place until 2028. So preliminarily, one of the biggest changes that I think just about everyone is aware of is that there are new work requirements for our Husky D population. This is our low-income adult population for the state. There has not been a work requirement for this population in order to receive health insurance up until it'll change on January 1st of 2027, at which time enrollees will be required to meet work requirements or the community engagement rules to get or keep coverage. One of the preliminary ways that you can identify if someone is qualifying is based on their income. And this is identified as $580 a month, which is 80 hours times the federal minimum wage. So if an individual is earning that much in money in a given month, they will be deemed to have met the Medicaid work requirements when they go into effect. Correspondingly, another way of demonstrating compliance with the work requirements will be the community engagement component. Individuals will have to prove that they have at least 80 hours a month of community service or participation in a qualified worker training program. They're enrolled at least half time in an education program or some combination of those that adds up to 80 hours a month. Next slide, please. I do want to briefly touch on the exemptions for the Medicaid work requirements. Like in the SNAP work requirements, there are certain categories of individuals who will not be subject to these work requirements if they can establish they meet a qualifying exemption. Preliminarily, just wanted to note that there is a veteran exemption, but it is different from the SNAP work requirement exemption, and that it will only apply to veterans with 100% rated disabilities. There are a number of other categories, as you can see up on the screen, that people might qualify for, but they will have to demonstrate that there is evidence or proof that they meet these requirements. The department is working on identifying as many of these data points as possible independently. Ideally, we are able to identify, for example, individuals who may meet a medical frailty definition or who are actively engaged in an alcohol use or substance use disorder treatment program through the current Husky program, which would then allow them to be exempt. Certain other populations, if they are meeting the SNAP work requirements or the TFA, temporary family assistance work requirements, they would also meet the Medicaid work requirements. And there's a couple more categories here. I won't read through all of them. Again, they're up on the screen. We will be continuing to work as an agency to ensure that everyone who's potentially impacted by this has the necessary information and directions about how to identify as an exemption or identify their compliance with the Medicaid work requirements when they go into effect in 2027. Next slide, please. So some other changes are also coming to the Medicaid or Husky program in 2027. One of these is that not only will the Husky D population be subject to work requirements, but there will also be more frequent verifications of eligibility. It currently runs on a once-a-year cycle of verifying a person's eligibility to get their healthcare coverage for a year. That will now be shrunk down to 6 months. So folks will have to come back in and reestablish their eligibility every 6 months in order to maintain coverage. There is a change also to our retroactive eligibility. Currently, if a person is uninsured and receives, for example, goes to a hospital for an emergency service, and they identify that they're potentially eligible for for Medicaid or for Husky coverage, they have the opportunity to demonstrate that they are eligible for that program retroactively up to 90 days, and the program will enroll them and cover those bills. That is being shortened. There will only be a 30-day window for Husky D and a 60-day or 2-month window for our other Husky programs, Husky A, B, and C. Next slide, please. And a little bit further down the road, just wanted to highlight yet another change that will impact the Husky D population. This is the introduction of member cost sharing. Right now, Husky D enrollees do not have out-of-pocket costs for the services they receive, but starting in 2028, states are required to impose a cost share of greater than $0, but not more than $35 per service for Husky D enrollees between a particular age income band within the program, those who fall between the 100% and 135% of the federal poverty level. The total out-of-pocket cost will not exceed 5% of the family income, and some services are exempt, including primary care, mental health, and substance use disorder treatment. And I believe that brings me to the end of this deck, and we'd be happy to answer any questions.
Thank you so much for joining us today. I saw that Senator Austin has a question.
Thank you very much. So as this is the Veterans Committee, I'll start off with a veteran question. How many veterans in Connecticut are losing their exemption in any way, shape, or form, either with SNAP or current work requirements that are changing?
Thank you for that question, Senator Austin. We identify based on national data, there's approximately 9,000 veterans in the state who are receiving SNAP benefits, of whom 5,000 we have identified within our systems as having that veteran status and that are currently exempt from the SNAP work requirements due to their status. So 5,000 individuals who will no longer be exempt solely based on their veteran status, but that may qualify for another exemption if, for example, they have a disability, and that information is shown to us. We can put them in a different exemption category.
And is the Department of Social Services reaching out to them to say they may have other exemptions, or are you letting the veteran service officers or any other veterans groups, letting them know that this is a possibility, that there may be other exemptions that they may qualify for?
Broadly, yes, we are advising everyone who is potentially at risk that there are other ways to either identify an exemption or to identify compliance. If, for example, they have income that is not traditionally on a W-2 form that we might already have access to, for example, if they're engaged in gig work or other types of services, and they have an opportunity to demonstrate that they're meeting the work requirements through proof of 80 hours a week or another income location, then they would continue to qualify for SNAP based on demonstrating compliance. But yes, we are messaging broadly, not specifically to veterans at this moment, though we would welcome the opportunity to engage with partners on how to outreach to that community specifically.
Because I think we have to message veterans specifically now that are going to not necessarily come across that message in other ways. Not to open up another wound, but the 100% disabled veteran there are different categories of 100% disabled veterans. How are you defining that? Because there's 100% permanently and totally disabled. There's 100% disabled that have to be reassessed every year. There are a number of different ways that this is categorized. How are you being directed to categorize that?
Yeah, thank you for that question. That will be driven by the federal guidance that we receive around, the exact provisions that are in HR 1 that identified that as an exemption, as well as subsequent CMS guidance that may clarify if there's some ambiguity in the federal statement about veterans with 100% disability. I will note that CMS, our federal partners for the Medicaid program, are not required to provide clarifying guidance until June of 2026. So we may hopefully receive some information in advance of that time. Otherwise, we will be waiting for the federal definition for who can qualify under that exemption. It may be well defined. I don't have that at my fingertips in the federal law.
And relative to that, are you proactively sending in questions that you have on this? That's, we could wait until June of 26, but if you have a question already, can you ask ahead of time? They may not answer, but can you ask?
Absolutely, and we do. Right now, we are sort of in a limbo where we have not gotten responses to a lot of questions. We are not alone in this. There are 50 states that are looking for clarification and guidance. So we partner very closely with our national associations to help aggregate and collect information that we think is, questions that are important to have answered by our federal partners. So those are being well documented and presented to our federal partners at every opportunity. And to date, we have not received very much guidance. We have been provided some suggestions that they will not wait until June 2026 to provide clarifying answers to some of these questions, but we do not have them at this time.
And my last question is not specifically related to veterans, but related to your presentation. And you said certain Native American populations. I asked the question before because it listed 2 specific categories, and they said California natives. I don't know what they mean by that. Does that mean do they have to live in California? Do they live here? What is this? And what are California natives? Because when I asked the Native American communities, they went, like this.
Yes, thank you.
What are we talking about?
Thank you, Senator. We actually did take that back and start to look into it more. A California Indian, as it's noted in the federal law itself, is simply a descendant of someone who was part of the original peoples of California. The other category was an urban Indian, I believe, is
Yep.
noted, is just, again, a Native American that's living in an urban center. So overall, when we looked at the definitions themselves, it is any Native American group, whether it's federal, state, or no longer recognized Native American, would qualify as for an exemption there. They just qualified these other pieces.
I'm sorry if I could.
That's okay.
I want to make sure I'm understanding what you're
Yep.
saying, and maybe we're going to explain it further. So an urban native person, there must be a definition for urban. So I don't know if, like, the city of Norwich would qualify, who knows? And they may have some Native American blood in them, and they say they do. They say they were affiliated with such and such an organization, and there are a number of Native American communities that are no longer identified as recognized Native Americans. So
Correct.
we have 5 state recognized tribal nations, 2 of which are also federally recognized. The qualification of federal recognition doesn't matter.
Does not.
Qualification of state recognized does not matter either.
Does not.
How are you assuring that somebody is Native American?
So we would really leave it up to the individual to provide us some sort of documentation or otherwise that they are a member of either a federally recognized, state recognized, or previously recognized Native American community. We're not going to be super prescriptive on saying this is the specific piece of documentation that you need to provide to us, but they would need to provide some sort of documentation to us showing that they are a member of one of these communities.
And the California Indian is somebody, I mean, I think that's sort of an odd, I thought it was odd the way it was
Sure.
rendered, but it's those Native Americans that were original to California before it was known as California.
Correct.
So they just picked one of the 50 states to recognize the original peoples. They just decided that the other 49 states didn't much matter if they had original Native Americans.
It would seem
So
to me that
confused.
they looked at the Indian Healthcare Act specifically and pulled out 3 definitions and put them into the bill itself. For your example of what they called urban Indian in the
Yep.
bill itself, it is not a person born in an urban center. It's not it's a person currently residing in an urban area that is a Native American descendant. So you could have an individual that recently moved from the most rural part of their state to an urban center, and they would now define that individual as an urban Indian, which is why if you look at the guidance that we've put out thus far for our work requirements on our website, we define it not as prescriptive. We don't use those 3 categories,
Well,
but what we instead say is a individual who is a descendant of a federally recognized, state recognized, or previously recognized Native American community.
And so that's what you mean by 3. There's 2 categories, but
There were 3 in the bill. There was
But-
Indian,
yep.
urban Indian, and California Indian.
What was the Indian one?
Simply a Native American.
Anybody that's a Native American gets an exemption. So I guess I'm not going to say anything because I'm confused. So can you send us those 3 or send me those 3 so that I can let the communities themselves know there is no qualification relative to disability or anything like that, that they can get an exemption, which may help out in Eastern Connecticut, where 4 of the 5 state recognized tribes have reservations and have a lot of their population living around the area. All right. Thank you. Thank you, Madam Chair.
Thank you, Senator Austin. I guess I didn't expect this conversation today, but thank you for going with the flow with us, gentlemen. I know you did. Yes. Your district is lucky to have you. So you seized the moment. I have a question. If you could go back a couple of slides, Sam, are you doing it to the one where we talk about, back one more? Nope, 2 more. Even more. One more from here. Okay, so the last, the Afghan and Iraqi special immigrants, I just want to point out, I don't know if I have a specific question, but when I became chair of this committee last year, the Connecticut Bar Association's chapter of veterans representatives had this special meeting that they invited us to, and they spoke about the efforts of the Connecticut Bar Association to help people who had helped service members safely navigate their time and service overseas, get here safely. And so there are a lot of folks in Connecticut that have were not just helpful when they were helpful to American soldiers overseas, but they are here now because of efforts of Connecticut residents from the Connecticut Bar Association who helped them seek this special status and be here. And so I think there's a lot of servicemen and women who might be interested in knowing that some of the folks that they helped navigate this process are about to lose food assistance, not just in the shutdown, but then moving forward. And so I'm curious, I worry that that population might be hard to reach right now. Some of the nonprofits that were helping in that space have folded in recently. And so I'm just curious how many people are in that category and if there's alternative ideas or suggestions for how we help, because I feel particularly sympathetic to the allies that our service men and women relied on and are now here, and don't want them to go hungry. So any thoughts about what'll happen in that population next?
Yeah, thank you, Representative Foster. That is a concern, obviously. I think there's a couple of actions that are taking place and can take place, which is, as Dan referenced earlier, it is possible for someone who arrived on a special immigrant visa to submit an application to change their status to become a legal permanent resident, which would allow them to maintain benefits. So that is one, or leads them a pathway to be able to preserve benefits with time. And so that is one avenue by which they might be able to be supported. I would also refer to our refugee resettlement agencies who have been very diligent about supporting our refugee populations in general across Connecticut, but in particular the SIV population. IRIS, CIRI, and JFS Greenwich. They are still all in business and providing services to individuals around the state. I believe that they would be the best group to go to see if there's additional supports that might be able to be provided.
Wonderful. And I'm just wondering, and maybe this is already happening and unnecessary, but if I could make an introduction between the group that invited us from the Connecticut Bar Association to you all, so you can explain that to folks, because I think they're like the unofficial legal counsel for those folks or official legal counsel for those folks across things. So they might be able to help people navigate that status since they helped them achieve their first status to begin with. So if that's possible, maybe you could just email me offline after who the contact would be to introduce them to. Okay,
We'd be happy to do that.
Thank you very much. Other questions for members of the committee? Senator Gordon.
Thank you for being here. And I also was on the Appropriations Committee informational meeting when you presented information as well. I know there's a lot of different numbers being about, and I know things shift as more clarification is being received by the states, including here in Connecticut. Do you have any estimate or a way of checking that if veterans are going to lose an exemption purely based upon their being a veteran, and knowing there may be other categories they might qualify for that they may not be aware of, and certainly they're going to have to find out. Do you have any estimate or any way of knowing if they might qualify for others? Do you have that type of data to have an idea of, how many there might be who truly might outright lose any exemption whatsoever? I'm not looking for an exact number, but just, is there any type of estimate that you guys have been trying to come up with based upon data that you have available at this time?
Yeah, thank you, Senator. It's a very good question. So we may be able to get you a more specific number if I go back and look at some of our data. Again, we've identified that approximately 5,000 veterans in the state are benefiting from a work exemption due to that veteran status. We have also looked at other information within our systems to see if there is a potential other exemption. And approximately 20% of all of the populations that we've been talking about subject to work requirements have an indicator of likely continued exemption due to, for example, receiving disability payments, benefits, or that's the main category, or they have income sufficient to demonstrate compliance, right? They may not have needed to demonstrate compliance with the work requirements because they qualified under the exemption. So our rough estimate, I would say, is about 20% of the 5,000 are likely to qualify under another category. But that is an aggregated number across all of the various work requirement populations, those who are between the ages of 55 and 64, as well as veterans, those who are previously covered by a town exemption and by or designated as homeless, for example. So I might be able to isolate that number for you and get back to you with a subset of the 5,000 who are at risk, but I would put it as, in absence of something more concrete, approximately probably 4,000 out of the 5,000 are at risk.
No, and I appreciate that, and we can take that offline, because many veterans are above the age of 65, and many of them do qualify for various disabilities. So I'm just interested to have some idea, but this is helpful as a start, and I'm happy to talk further with you.
Thank you. And I would say the age is obviously something we are also aware of, and we would have excluded them from that count.
Thank you.
Yeah.
Thank you, Senator Gordon. I believe Representative Nolan has a question.
Thank you. I'm going to go back to the discussion in regards to Indian, urban Indian, and California Indian. And because there was nothing mentioned in regards to, I just want to get some really good clarity on this. Is there anything in that language that talks about skin tone or anything that distinguishes light skin Indians versus dark skin Indians? Because it's kind of like, just seems weird that there's 3 categories for Indians when Native American blood is Native American blood. It's just disturbing how they're separating it. It just.
Yeah, I appreciate what you're saying. This is strictly based on the federal definitions that are applicable to the population. So I think that they are a product of history and how groups were identified over time, that they may have been categorized in slightly different groups. By and large, we are largely interpreting this to collectively mean anyone who has a Native American descendancy. I have learned through research, though, that I'm far from an expert in this, and I'm learning, I think, along with many other people, that there is a certificate of Native American descendancy that is fairly common, and that would be an example of proof that you would meet any of those 3 categories without having to, bucket yourself in, an urban Indian or a Californian Indian definition. So it is, I think, better perhaps understood as a catch-all for Native Americans who have the ability to demonstrate their ancestry, and they would become exempt on that basis.
Okay. If you wouldn't mind, could you send us those definitions?
Sure. Yeah.
So we wouldn't spend too much time having to look them up. Not that we wouldn't, but it'd be easier if you could send them to us.
Yeah, Representative, we will send that. I will note as well, specific to urban Indians, that there is a National Council of Urban Indian Health that operates health centers within urban areas, and that may be how they're categorizing who is considered an urban Indian. But to our understanding, as I noted earlier, the definitions that they provided were from the Indian Healthcare Improvement Act, the Federal Indian Healthcare Improvement Act.
Okay.
But we will send you both the definitions and what our understanding of the definitions are.
Okay, and I'll reach out to our tribal, our 2 major tribes and just get an understanding from them also and get input. But I just need to know in case someone asks, because it came out, and I just want to be able to explain it if I have to. And one more question in regards to if we go back to the community engagement rules, is there anything created, or do you think there could be something created to give a little bit more specifics to people in regards to those things that they can go out there and do. I thought I seen some things on your list, but I just wanted to make sure how we can help people understand a little bit more clearly.
Yeah, so we did actually set up a website that has a pre-screener that
Mhm.
asks, I believe it's 9 questions, and says, first ask the individual's age, so that if they identify as being over 65, for example, it would automatically tell them you're exempt. You don't need to do anything else.
Okay.
But then ask, do you live with a child under this age? Are you a student? Do you receive VA disability benefits? Things that we know are exemptions. If they say yes to it, it'll say, great, you may qualify for an exemption. Here are your next steps. It goes through and then also says, are you working? If so, are you making X amount of dollars, this amount of hours? Are you volunteering, et cetera? So it goes through all of our exemptions, all of our questions as to how to be exempt, as well as how to meet the work rules. And then at the end of it, it offers them additional resources like our SNAP employment and training program that offers free training to individuals receiving SNAP benefits. That is job training. It offers the website for the United Way that shows volunteer opportunities in all of the towns and cities in Connecticut, as well as specific to each individual's town, their community action agency. So they can go there and find those resources as well, or it directs them to 211 or the United Way for food resources. So that's located at www.ct.gov/snap/ABOD. We could provide that link to the committee after this as well. But it's really, as I said, very simple, 9 questions online that they can go to. And then also has informational areas that provide the rules and all of the exemptions separately. But this is a good first step to say, do I need to do anything? If so, what do I need to do?
Okay. And just to reiterate, I'd like to receive any information that I can that would help educate the communities. So don't be shy about sending out whatever information that you have that we could put out to our constituents. I think it's always important to educate and inform. So we're staying on top of what is out there and what's available.
Sure.
And I appreciate all the work that you are doing. Thank you, Mr. Chair.
Thank you, Representative Nolan. Are there any further questions from the committee? Seeing none, thank you both very much for being here.
Thank you for having us.
Next up, we have Katie Zarzika, the president of the National Guard Association of Connecticut. I hope I pronounced your name correctly.
Good afternoon. My name is Katie Zarzika, and I am the president of the National Guard Association of Connecticut. Thank you to co-chairs Representative Foster and Senator Hoenig, vice chairs Representative Delaney, Senator Lesser, ranking members Representative Anderson, Senator Gordon, members of this committee for holding this informational hearing. I am speaking here today on behalf of National Guard Association of Connecticut, which advocates for the Connecticut National Guard, its service members, and their families. I will start by speaking about the effects that the government shutdown has had on the Connecticut National Guard, as well as other issues that have arisen in recent years due to federal budget decisions. In the midst of the second longest government shutdown in U.S. history, the Connecticut National Guard is maintaining baseline daily operations to ensure those units designated for mobilization continue to build readiness, and those units in the state are ready to respond to serious emergencies that threaten life and public safety. However, continuing these baseline operations with no appropriation to purchase fuel, spare parts, and no guarantee of pay for our service members or full-time federal employees is a serious cause for concern. While most of our active duty and drilling members receive their military pay so far for the month of October, there is no guarantee that it will continue. In regard to compensation, our Title 32 dual status military technicians full-time support workforce is of particular concern. Dual status military technicians hold a distinctive place within federal service. They are federal civilian employees who must also maintain membership within the National Guard. They wear their military uniform throughout the civilian work week. In appearance and conduct, they are virtually indistinguishable from active duty personnel. The distinction lies in their legal status, pay, and benefits, which often fall short of those provided to their active duty counterparts. Despite performing some of the most essential work in our organization, they are among the lowest paid members, and now they are not being paid at all. Some of these workers have since been furloughed, putting their positions and potential back pay at risk. Aside from our dual status military technicians, the Connecticut National Guard currently has approximately 800 soldiers and airmen deployed overseas. Most of them were paid last month, but it is unlikely that they will receive their end-of-month paycheck. There are few situations that can bring more distress to a deployed service member than difficulty at home. I am sure that for many of them, missing even a single pay period has devastating consequences. I know that there is little that our state government can do to alleviate these challenges, but I think it's important for you to understand what these members are currently going through. It is important to note that the Connecticut National Guard has been struggling due to a stagnant federal budget well before the start of this current government shutdown. The Connecticut National Guard currently operates with approximately 50% of our validated full-time manning requirements. Training money has been continually flat, which is an effective reduction in the name of DoD capital investment into technological needs of the future. Vehicles sit in maintenance shops with no repair parts to repair them. Service members who volunteer for extra schools are then unable to train with their units due to limited funding. Hiring freezes for the active force within the Guard are frequent, making it difficult to hire the people who run the organization when the part-time force is away. These are not unique challenges to the Connecticut National Guard. They are being felt across the 54, but unlike with the government shutdown, there is places for Connecticut to step in. The state of Connecticut can continue to support the National Guard by fully funding Connecticut Military Department programs such as JEEP. The state can establish an emergency response fund for in-state operations that help fill gaps when federal funds are unavailable. Our guardsmen and women are more ready when they are financially secure. It is time for the state to expand education benefits for our service members and veterans pursuing traditional and non-traditional higher education. For example, we can eliminate the hidden fees that plague our tuition waiver recipients, expanding credentialing options, and creating a state GI Bill. These open multiple future opportunities for service members. The members of the Connecticut Guard are highly dedicated, but dedication alone is not enough to be ready for the next emergency. The National Guard needs the support of the legislature, the Connecticut Military Department, and the people of Connecticut so that we can continue to always be ready and always there. I'd like to address your question earlier, Representative Anderson, about the ID cards. So currently, our DEER's office in Middletown is open. So if people need to get in a military ID, whether they're retired or currently serving, they can. And then there's also, if for retirees, effective December 31st of 2025, their current ID cards will no longer be valid and they will not be able to receive services. So they were supposed to go to a local DEER's office and get the new Uniformed Services ID card. And it's an updated card with more security and stuff like that. So I believe that's what the issue is, because once their current cards expire, then they will not be able to receive any kind of benefits. You're welcome. Any questions?
Thank you so much for joining us today. I really appreciate your thorough presentation. I have a couple of questions for you, if you don't mind. The first, a couple of times during public hearings, we've sort of mentioned the 998 dial 1. I always feel like that's sort of getting people at the last moment of emergent situations. Is there something that we should as a state be doing or considering to support our troops, especially when it comes to their mental health and associated health care?
Absolutely, a very passionate project of mine. So there are resources out there, but I think we need to be a little more preventive versus reactive. So currently, we do have a military support program which has embedded clinicians, where I believe we're the only state across the nation that has embedded clinicians within our units. I have personally used their services, and they are phenomenal. We would like to potentially add more appropriations to that program so that we can expand those services. One of the problems that a lot of active duty soldiers face, and anybody that has TRICARE in general, to become a it's difficult for practitioners to become a TRICARE provider. Many times the process is very difficult, takes them 2 or 3 times to get it. So sometimes as the saying goes, effort isn't worth the squeeze. And then in addition, TRICARE reimbursement rates tend to be low. There was also a point earlier this year where TRICARE was behind in paying out reimbursements. So then that causes lapses in care. So that's part of the problem. So if there's a way that we could potentially provide more providers specifically for long-term care, so if we did something similar to the Troops to Teachers program, if we were able to develop like a Troops to Therapist program within the state, I think that would increase the number of providers and help service members actually find providers that are willing and available to take them. Another thing is that we've set, how do I want to say this? We're not immune to suicide, obviously. We represent the population. So we've set the trend on, we have the models on how to do things. We just need to expand our models and potentially get additional funding to adopt other models that have worked across the state.
I appreciate you talking about that. I'll just say for the committee's knowledge that this is something we've discussed before, and we've put in requests for information to sort of get an understanding of best practices statewide on what we can be doing in the mental health space. And I know that that the military department is advancing programming, but there's more willingness. There is willingness, and it's about resources to make more work happen. And I do think that the Troops to Therapists, that sounds like a great model and idea. And I'd be interested to hear what people were saying in a public hearing when we get that bill on the agenda this upcoming session. You mentioned the Emergency Response Fund. I would love if you could talk to me a little bit about how that is used, what it looks like right now, what that system is about, and I'm sure I'll have follow-up questions.
So currently, the way our process works, if the National Guard gets, we'll just use a hurricane as an example, and we decide to activate the National Guard for response. Currently, the state active duty funds to put service members on state active duty orders comes out of the Connecticut Military Department's operational funding that they have. And then they have to then request further funds from OPM to replace what they spent out of their operational dollars. So it's essentially, it works almost like an IOU for the state military department of like, hey, we spent our money that we had allocated for other things. Now we're going back to the state to try to get it back. It would be significantly easier if there could be a separate line item specifically for state active duty funding so that the state military department can just go straight to that pot of money and activate service members for state active duty and not have to worry about tapping into their operational funding, especially if there's a state emergency towards the end of the fiscal year where most of their appropriation has already been spent. And then that, would impact how many service members they can bring on duty to do that. So if there was a separate fund specifically for that, it would make the process significantly easier, more efficient, and give the military department more flexibility in who and how many people they can bring on state active duty orders to respond to a state emergency.
So it sounds like when there's an in-state mobilization effort, usually in response to an unanticipated emergency, then we have to talk about mobilizing money before we can determine how many people we can mobilize, and that delays the emergency response and then could potentially end up with unrecouped cost for the military department when they're already underfunded. Okay.
Yep.
Is there an amount that you think you're interested in seeing?
I do not have a specific dollar amount. I think we would be able to potentially look at the different emergency services functions that we support and what units would support them, and then look at payroll costs for those functions. So that's something that we would have to come back to the table with.
I wonder if that's an OFA request we could consider, if that's okay, to look at what the last couple of it would be state active duty deployments were and what they cost, and sort of how much and where the money came from to fund that. That might help us better understand where we can go. Thank you so much for participating. I'm going to look for questions from other members of the committee. Rep. Anderson? No? Okay. All right. Seeing none. Thank you so much for joining us. I appreciate you. Our next speaker is from Connecticut Veterans Legal Center, Allison Weir. She's the executive director. Thanks for joining us today.
That's a huge benefit. And I am happy to talk to any municipality who wants to know why TDIU veterans should be extended the property tax exemption, but I won't get into that now. I do want to sort of break up my comments on three ways. First, the shutdown, the big beautiful bill effects, and continuing concerns. Commissioner Welch identified what the VA services are still in effect during the shutdown. For the most part, we're not seeing a lot of issues. We are seeing some delays in benefit hearing and benefit appeals hearings, just because I think mostly the staffing is considerably less in the VBA. VBA, of course, is on furlough. We are hearing from veterans that the appointments for mental health appointments of the VA in particular are being delayed and are much harder to get. We're digging into that a little bit more to see what's happening there. But otherwise, it seems that things are continuing largely apace. People are getting their benefits. We are worried about folks who have been furloughed, who are veterans themselves and are no longer getting a federal paycheck. We haven't seen a huge influx of veterans yet from the state, but I imagine if we lose a few more paychecks, we might see some more from that. On the Big Beautiful Bill Act, I'm indebted to Deputy Commissioner Hadler's discussion of what the changes are, because I was not entirely sure of exactly all the exemptions are available. I will check with the department a bit more to understand what level of disability will qualify as disabled, because I wasn't sure that that was the case. I thought perhaps veterans would have to qualify under the Social Security disability level. That said, a lot of our most vulnerable clients are the ones who are not currently connected to the VA because of bad paper discharges, who may thus be who might have fallen under the exemption as a veteran or as homeless, but will not fall under exemption if you require a service-connected disability. So we need to look into more about that. And again, most of our clients rely on the VA for their primary care, but some do use Medicaid. And those new work requirements are likely to burden people who need health assistance, even if they're currently working. The majority of people on assistance who can work do work. And I think the addition of these work requirements just add more of a bureaucratic red tape as opposed to actually getting more people to work. Continuing issues, housing affordability continues to be an issue for our clients. Even with the resources we can tap into through the VA, such as the VA supportive housing, the HUD voucher program, the homeless team, the various supportive services for veteran families programs throughout the state, housing affordability remains the #1 challenge to keeping veterans housed. Through right to counsel, we can avoid an eviction on a veteran's record, but we can't find them an affordable place to live. The newly reconfigured Unite CT program was rolled out so secretively that we at CVLC didn't even hear about it. And the rules to getting access to it seem remarkably tough and restrictive, sort of a one-time use compared to the Unite CT program we had before. That was really very, it was very accessible for getting helping with eviction arrearages. So I think if there's to the extent that the state can provide assistance with rental arrearage assistance or assistance with security deposit, it could help us get veterans more housed and as they transition out of living in systems they can't afford to situations they can't. So that's all I have. I thank the committee for its work, and I'm happy to assist in any way I possibly can.
Thank you so much for joining us today. Can you just say which program took over for the
There-
Unite CT? That's confusing.
So there's a new Unite CT program.
Okay.
And as I understand, you can never have used it before. I think, I'm not entirely sure of all the rules because we really just learned about it like recently. The other legal services programs have all said that they've tried, they don't know if anybody's actually successfully gotten money from it. So,
Okay.
the other program was fairly straightforward. You applied, you told what the rearage was, there was a certain cap, and it did sort of help folks preserve security deposits, or at least clear a record, or even have the landlord allow them to continue on in the position in the place for a while. So it's just housing affordability is not unique to veterans, of course, but it is something that we see a great deal as an issue.
Well, I think this is probably something that I think the committee had legislation this last year from a variety of different legislators with a variety of different ideas of how we might pursue addressing housing insecurity for veterans. And although we didn't advance one particular bill or proposal, I do think that there's an appetite bipartisanly and bicamerally to do something in this space. So I think if you can give us sort of concrete levers that we can pull policy-wise, I think we're eager to hear and advance those. And then I would also just ask, we weren't able to include representation from the federal VA, obviously, for obvious reasons in their presentation today. Are there things that you're hearing from the veterans that you're serving that you think that we could stand up serve as alternatives as the state, or that we should be thinking about or concerned about, or at least maybe trying to convene on? I worry that when things like this happen, people are anticipating that it'll get resolved, or they anticipate that another system will stand up, and we just notoriously end up with silos where, and I just noticed there's like this bifurcation between state and federal services. And I worry about people getting frustrated in moments of incredible duress and not being able to navigate to where they need to go. Is there something that we could be doing as a committee that would be helpful?
I mean, I think your earlier question to questions about crisis and mental health is certainly on point. I think one of the things I'm most concerned about, not that there's been any like official policy, but it does seem that the federal VA wants to move more towards community care practice. I think that's going to be particularly difficult with mental health issues. One of the things about VA healthcare currently, is that it's very holistic. It's a whole team, and it's mental health and physical health, and then all the social services and caseworkers that go along with that. We, as part of the medical legal partnership, are just part of all of that holistic service. If veterans start getting their care from individual community care providers, you won't have that same holistic service. It will be harder for us as part of a medical legal partnership to work with clinicians. And I think we're also going to find that there aren't that many more mental health providers out in the community than there are in the VA. The community systems are already currently strapped as it is. And I think mental health is probably the area where I'm most concerned, frankly.
I feel similarly worried. One of the things that I've been sort of thinking about for sort of like background for committee members is, we know like the patient-centered medical home, which is what the VA functions as, but so do our federally qualified healthcare centers, that those models result in people getting better referral retention. So let's say you have like a preventative gynecological exam, adverse findings at a pap smear, you're more likely to follow up at a colposcopy, which means you're less likely to end up with cervical cancer.
Right.
Interesting that I just chose a very female specific example in this audience, but that's the example. You're more likely to get through the system if you are in a patient-centered medical home. Diabetes, like you're a veteran with diabetes, while you're there, you say that you don't feel anything in your toes. You need a neuropathy follow-up with a podiatrist. And if you don't do that, it's higher risk of amputation. And people who are in these patient-centered medical homes, they just are more likely to not have the secondary consequences of their healthcare being seen in sort of the silo view.
Exactly.
We actually, right now as a nation, do very, very bad with poorly with referrals. People with high incomes and people with low incomes, people who are aging, we have a really high rate of people who are lost to follow up when they have to get referred to multiple providers. And that's especially true in the mental health space. I'm curious if you think that there's a community health worker model that might be helpful in this space. I think healthcare navigator roles can be filled by community health workers, and the Public Health Committee has been sort of pursuing licensure and credentialing and then subsequent Medicare reimbursement for community health workers. Do you think that if in the case that that's what stood up, is that the community care model is what sought patient navigators who are community health workers, that would help? I'm just trying to think of things that we can be doing and planning for preemptively, so we're not standing up structures after we find out about a risk. Or if there are other thoughts you have on how we
Yeah,
should be
I
prepared.
think that could help. Let me think a little bit longer on it and get back to you. I think the other thing too is caseworkers. So if a community health worker, but also can connect to other social services too. One of the reasons the medical legal partnership model works is that folks having health issues often have other legal issues, especially if those health issues are in part due to poverty. And also people with legal issues may have health issues. If you're suffering from depression, it's hard to get on top of your bills. It's hard to also, if you're at risk of losing your home, it's hard to get better. So I think a community health worker and maybe some kind of a caseworker model could really be helpful.
I appreciate that. I do feel like in my brain, oftentimes the VSO role feels like the VSO and Office of Advocacy and Assistance, it feels like they should have some of that embedded internally or connect with DSS that way. And that might be something we consider as a committee moving forward, as how to sort of make sure we break down that silo between like the VA benefits and any other social service benefit that we know that there are folks that definitely need. It feels siloed to me. And in this moment where I think a lot of people are very stressed and the stress is financial, I feel like I'm feeling that brittleness, and I'm interested in finding ways to address it moving forward. So thank you. Any other questions from members of the committee? Yep, Senator Honig.
Thank you, Madam Chair. Thanks for being here, Allison. Really appreciate it. You had mentioned earlier the eligibility for public defenders that we passed last session. Do we have any information as to is that being used on the ground or being fruitful?
I'll have to check with the BJOs on that, Senator. It was a recommendation that came to us through the BJOs, and the big concern was that there were different judicial districts were applying it differently. So I think if nothing else, we have no consistency.
Thank you.
Seeing no other comments, thank you so much for joining us today. We appreciate you and we look forward to staying in touch. The next speaker, we're going to wait. Mr. Lewis is unable to attend, so the next speaker is going to be James Matthews, the chair of the National Legislative Committee of the Veterans of Foreign Wars. Thank you, sir, for joining us.
Thank you, ma'am.
Good afternoon. Thank you for the opportunity to speak. I would also like to thank the team's hard work last session to get the HEROES Act across the table and get that signed. That was a lot of work, and it's going to help a lot of veterans and family members across Connecticut. So at the state level, I'm the chairman for Jim Matthews, chairman of the Department of VFW for the state of Connecticut. And part of my job as a chairman for the state of Connecticut is I am a member of the national level Legislative Affairs Committee. And so my main focus is providing guidance of the priorities and goals of the national level initiatives to our elected leaders down in DC. We also have a state representative that focuses on the state level initiatives that you guys take care of. And so today, there are a couple things I'll talk about the state, but I would like to bring up and advise you of what we're trying to do at the national level so that you can synchronize your efforts with federal efforts so that Connecticut continues to give the best support to our veterans across this good state of Connecticut. So here in Connecticut at the state level, the Department of Connecticut VFW strongly encourages the annex option for the Connecticut Veterans Cemetery. Being centrally located in Connecticut, we think it's very important for our veterans that their final resting place is centrally located so that the residents of Connecticut that have lost their loved ones have the opportunity to not travel from one extreme of the state to the other. We think the centrally located option is best for all Connecticut residents that have members of their family buried there. Now, I would also like to just address the fact that there are concerns from local communities about contamination of the grounds that would be expanded. Well, there are options now of green options for burial sites, and I would encourage that should also be part of the variable when we're looking at solutions for the current status of losing space at our Connecticut cemetery. The second thing is I would like to bring up a recommendation to pass liability waiver language for any entity that would be federal and state military departments, veteran fraternal organizations, veteran support, nonprofit organizations, firearms dealers, firearms repair shops, firearms manufacturing companies, firearms ranges, firearms hunting clubs, etc., that provide low to no cost voluntary out-of-home lethal means storage options to active duty, reserve, and National Guard or veteran service members and family members. The intent of this effort would be to provide an additional lethal means barrier option to our current serving service members, veterans, military retirees, and family members. And it would also provide Connecticut-based active duty, reserve, and Connecticut National Guard commanders a no-cost suicide prevention tool for our reserve and Connecticut National Guard community members. Now, I would like to just remind everybody that there has been a great campaign over the last several years, the 22, to get at suicides across our military community and our veteran communities. And it's been successful because as of 2022, the numbers have reduced to 17.6 on average per day, but that is still far from where we want to be. So this is just another tool to provide to our veteran community members to provide a barrier for lethal means that they have available to them that they may want to voluntarily give up to help extend that initial concern that they have for taking their own lives. Now, the potential financial and beneficial impacts, there's an avoidance of additional lethal means suicides within our military and veteran communities, obviously. But firearms are, I will tell you, firearms are used in 70% of military suicides, and lethal means by firearms is 90% effective. It's just the facts. So financial burden that we incur is $500,000 life insurance payout per service member suicide, $100,000 life insurance payout per service member spouse suicide, a $10,000 life insurance payout per service member dependent suicide. Various levels of civilian life insurance payouts for veterans, military retirees, and family members are also part of that package. Avoidance of legal liability lawsuits can be achieved. and federal and state employees' annual salaries rounded up to the nearest 1,000 plus $2,000 is another variable that's added to that financial cost. Now, researchers at the University of Kentucky have found that for every suicide, 135 persons are affected to some degree per suicide. For other efforts already actioned elsewhere, I will tell you that the state of Washington and the state of Colorado National Guard departments have already established voluntary personally owned weapons armory storage policies in their states. And Washington has had that in place since 2014 and Colorado since November of 2017. The state of Washington and Louisiana have also passed legislation, liability waiver language to get at more involvement from veteran fraternal organizations, veteran support, nonprofit organizations, etc. Washington State passed HB 118 in 2022, and also in 2022, Louisiana passed HB 260 in their state. And it's about giving waiver liability or liability waivers to people that are providing these low to no cost options for lethal means storage outside of the home. The University of Colorado and Anschutz Medical Campus has spearheaded the Gun Shop Project, which partners with firearms businesses to promote safe storage and suicide prevention. And in Wisconsin, the Department of Veteran Affairs has been working for several years now, working with voluntary storage programs with firearms dealers and ranges in Wisconsin for some continued work liability waiver legislation. So the bottom line is with all cards on the table, sometimes the care for our service members, veterans, retirees, and their family members, organizations, and I mean at our level, the state, must take risk. And I would offer that we need to change legislation because if we can provide that extra barrier to our service members and their family members, it may save more lives. At the federal level, to help you steer your committees and your efforts, I'll just give you an update real quick on some of a highlight of some of our priorities and goals at the national level. Community care reform. Partially, this effort is to avoid prioritizing the VA. We do want community care because it provides access to medical needs, maternal wise, mental health wise, et cetera, instead of taking long trips to VA centers that may not be easily accessible by our veterans in rural areas. We are also working, and that's right now, we have two bills that are in committee. One is for Veterans Access Act, and the other is Foreign Medical Program Modernization Act. And you do have some service members that are Connecticut residents that are residing overseas, either temporarily or in retirement. We are also working on exploring alternative PTSD treatments. This has been a priority since September of 2024. For several years, we asked congressional leaders to use their authorities to direct the Department of VA and the Department of DOD to do research at some of the groundbreaking treatment therapies that are alternative within the civilian communities that are having some great success. So when you see your national legislative representatives, please encourage them to continue to support this. Right now, we have some promises that they're going to look at this strongly and help get this across the way. Connecticut, we are very fortunate to have the state system that we have because our veterans have really good care here in Connecticut, but we are focused on the entire nation. Military retirement for military personnel. Right now, the Major Richard Starr Act is a huge one. I won't get into it. Your representatives at the national level, 6 of the 7 offices have signed on to this bill. All they're trying to do is, right now, there's enough votes and set aside the shutdown. There's enough votes to support getting it to the floor at some point in the House and the Senate for a successful pass on this bill. Transition from service, you've heard that the TAP program is being paused right now. The VA has done a revamp of their transition assistance program classes. They call it TAP 6.0 back in 2024. We at the national level VA, we believe that getting lost in the soup that first 12 months after veterans are finished their contract or released from the military, there is a spike of suicides in that first 12 months. And we believe it's because there's a lack of full understanding of access and what benefits are available to veterans. We believe that they get lost in the soup. They don't know where to turn, even though that there's veteran service organizations out there available to them to help them. So what TAP 6.0 had done was across a few major installations across the country, one of them being Colorado, they have found success where this new TAP 6.0 allowed veteran service officers to come to these classes so that the benefits could be explained, for one, and two, veterans that are military service members that are being released from the military obligations their VA documentation is being initiated prior to the departure so they don't get lost in the soup. And they have found some indicators that has helped significantly. I had heard earlier speakers talk about a state level TAP program. By far, we encourage that. We think the TAP program is something that sets current serving service members up for success when they transition to the civilian life. It releases a lot of stressors. We're going to continue to work on unaddressed toxic exposures. We're going to continue to work at cracking down on predatory claim companies. I know the state of Connecticut, we are resistant right now because we are not able to get individuals that have gone through issues with these predatory claims companies to step up and say, yeah, I did it. That's not something that we do. As veterans, you probably can understand that the concern that some would have that they would be targeting themselves for bad publicity. However, I would encourage you guys that we should address the issue before it becomes an issue if you think that it isn't happening in Connecticut. It is happening in Connecticut. Predatory companies are out there and they're aggressive. Right now, there is current legislation. There's a bill in committee. It's called the Veterans Choice Act. Now the Choice Act of 2025 right now has some language in it that allows these predatory companies to charge upwards of a cap of $12,500 to help veterans obtain their claim or process their claims. And that is on future benefits. The VA's red line is no veteran should go into debt before they start receiving their claims. So if they get, for an example, if a veteran gets a certain percentage for easy math and gets $1,000 a month, and they go to one of these companies that are charging future claims, and they're getting $3,000 a month, and it takes three months to process the claim, they'll get a retro check of $3,000. And then the remaining, they could be charged $12,500, so $9,500 is future funds that they would have to pay to these companies to help them process their claims, where the VSOs of our veteran service organizations and the Connecticut VA will do it for free. And we're trying to get the message out there to them, but sometimes people just can't wait. However, right now, there authorizes attorneys to charge, but it's only on retro pay. And that's where the VFW draws a red line. We would like it to only apply to retro pay versus future pay for disabilities. And the last thing that we're working on at the national level is the GI Bill improvements. Right now, for those of you that don't know, Reserve and National Guard service members do not receive full eligibility for the GI Bill for every day in uniform. Basic training, AIT, any of their professional development courses, any of their state on the National Guard side, the state active duty days, those are not eligible days towards eligibility for their GI Bill. However, on the active duty side, every day in uniform equates to eligibility. So they hit that 36 months and they've met their requirements. It could take 12 years for Reserve and National Guard members to equate to that with different deployments that they do. So one bill is the Parity Act bill to make sure that every day in uniform for a National Guard and Reserve service member is eligible for GI bills. And the other two bills are just getting at an update to the BAH payment and the book stipend for students in the GI Bill system, because it hasn't been updated since 2009, and we're looking to increase that for our veterans that are using the GI Bill benefits. Pending to your questions, that's all I have.
Thank you so much for joining us today. I'm hoping that after this public hearing, the committee can sort of gather up all of the resources on things that folks are doing and make sure we're disseminating it through all 4 caucuses about people willing to sort of stand in the gap while folks are struggling with the shutdown. And I thank you very much for your testimony. I do want to plug, we have a working group or a study being conducted by the VA on the Claim Shark legislation. And so I'm hoping that you can lean in and collaborate with the CTDVA and share your feelings. We weren't able to pass that legislation through this year to do the full prohibition as was requested by a couple of the advocacy organizations. And I think that there is still appetite to continue to pursue that. And we just want to make sure that as we draft it, that it'll withstand some of the court challenges that have been seen in other states. So I really hope that if you have specific examples of people who have been harmed by claim sharks, that they're filing complaints with DCP and the Attorney General's office, and that you are sharing information on what's happening and problematic with the state VA who's working on trying to help make sure we draft concerted legislation moving forward. So thank you so much.
I would also offer to you that, at the national level, we believe that the VFW believes that this is a federal level benefit. It should be addressed at the federal level. But there, as you can see, we have a shutdown going on. It's very hard to get stuff accomplished down in DC at times. And the state of Connecticut was poised to be the 10th state that would have legislative at the state level. But the challenge that we see at the VFW is that if we were the 10th state to enact some type of legislation, that means that there's 10 states that have a little different skew on how we take care of this predatory claims issue. So the states, although it's great that some of them are passing legislation, they're not all the same, and they're all impacting federal level benefits a little differently. So we are doing our effort to get it passed at the national level, but we appreciate the support at the state level to ensure that we're protecting our veterans and their family members and caregivers in the meantime until we can get it done at the national level.
There's a interesting article in a publication called The War Horse about this process and the legal efforts moving forward to try and challenge it. And they talk specifically about one of these companies, and sort of the process of navigating their, their legal, skirting the legal line status as they move forward. But what I will say is, in the article, employees who worked for the company complained. It seemed like there was a significant fiscal deficit to the federal VA, and it did not include customers complaining. And so that was my personal struggle, even in this article as we were moving forward. And I understand that there's like this long lasting impact. So I'm going to take responsibility for being sort of like swept up this last year as we were navigating this process in this legislation. I really wanted to make sure that I pulled the lever that was protecting the veterans who could be getting the benefits. And I feel like the federal government should be pulling the lever that's protecting the coffers of the federal VA. And I know what you're saying is, totally true. I think this is a challenge that we're going to have to navigate. But I think, there was executive branch support and the attorney general supported doing this work. There was really a lot of your organizations were all supporting it. It was the how that I was really struggling with. And I think a lot of us, we were trying and we were eager to try and do this, but how we got it done wasn't clear. So we will continue to work on it, or that's my commitment. I will continue to try and work on it moving forward.
We appreciate that.
And I'll send you this article. I want to sort of, you were talking about lethal means reduction at the beginning, and I want to flag coming up in January, we have a bipartisan, bicameral conference that I've been hosting. This will be the third year, called Moving Beyond Implications. And we invite scholars in Connecticut to present their research that's meant to inform policymakers. A lot of times when people are scientists, at the end of their paper, they'll write implications for policy include, and then it's behind a paywall and no one actually reads peer-reviewed research except for the other scientists. And so policymakers don't actually implement evidence-based strategy because they don't have access to that. And so we've invited scholars, and my partner in this conference is Dr. Carrie Rassian. She was at UConn at ARMS, which does lethal means reduction. She's now at Yale, and her expertise is this, is lethal means harms reduction. And I think that there is a lot that I think that there's interest in advancing legislation that protects folks from suicide. And I think that there's a lot of evidence about the exact kind of things that gets presented at this conference each year. And so I think it would be wonderful if you're interested. I'll give you some more information. But we have Connecticut researchers who have produced and contributed to the body of evidence you've sort of outlined in your testimony. So shout out there.
I would also offer to you, ma'am, that the state of Connecticut National Guard, I was a former employee of their prevention program at the Joint Forces headquarters across the street. That's all they use. Well, not all they use, but they use a lot of research documentation to help develop products and stuff. When I was there, the team was part of the governor's, it escapes me now, but there's a program that Kathy I think she was one of the leads that brought in all different associations that we were working towards many different products to help with that. This was just what I had talked about, the lethal means storage, was getting at the fact that right now, when I was with the Connecticut National Guard, and I'm retired 34 years with an Army Reserve as a Command Sergeant Major. We had many suicides on that side, and we were always struggling how to get ahead of the bubble, right? So working with the Connecticut National Guard, right now, the commanders do not have the authority to accept weapons from service members that come to them and say, I'm struggling right now. It's in my home. I have access to it. I'd like to create that other barrier because current policy does not allow them to do that because there's restrictions, and most of it is based in support of the Connecticut laws right now. Because you have to transfer possession of possession, for lack of a better term, but ownership. And even though it's temporary, that is a barrier that restricts service members from, I don't want to give up my ownership, because let's face it, the military, the code of honor that is instilled into our service members while they're serving, part of that is defending this nation with arms. And if we take away those arms with questionable access to return them to them, that is going to restrict them from taking advantage of the options that they have. But if we can guarantee them that they're not losing their authority, and give commanders another tool in their toolkit to be able to care for that service member, take the weapon temporarily, it's the liability of giving it back. And what happens then? Yes, that's a question, but we can't fix it all. But if we can say, when I got on the team at Joint Force A, we had 4 suicides in 3 months that I was there. So Connecticut National Guard and the reserve system, you guys don't have a lot of access to the reserve system, but they are here in Connecticut throughout the state. Your reserve centers, the Connecticut National Guard actually shares buildings with the Army Reserve. And then you have the Navy Reserve, et cetera, right? So this could impact a lot of people throughout our state in a very positive manner if we could help provide them that extra barrier that could be beneficial to them at the lowest level of leadership actionable capabilities.
I think we'll be looking into this moving forward, and I initiated an email change to add you to make some introductions to see if
Okay.
there's something that we can do. Any other questions from members of the committee? Go ahead, Representative Delaney.
Thank you, Madam Chair. Sergeant Major, thank you for your presentation today and for your service and for what you're doing for the veterans community. First, just a quick bit of housekeeping. Could you please provide the legal language for your state level legislative requests and the supporting documents to the committee for our review?
I can give you a white paper I put together.
All right, a digital version, please,
Sure.
if possible.
Absolutely.
Thank you, sir.
I just need to know who to send it to.
We can get you connected to the clerk and the appropriate staff for that.
Outstanding.
And second, I just wanted to take a brief moment to tell you how strongly I agree with and appreciate you lifting up the issue of the lack of the transition assistance program and tying that into both mental health and suicide for soldiers. Sergeant Major, as an NCO myself, I benefited from the transition assistance program, mainly because I had phenomenal senior enlisted NCOs that squared me away. And I am unfortunately know soldiers that did not benefit from the program and saw firsthand how that negatively affected them. And I just wanted to thank you so much for lifting up that issue. Thankfully, our municipal veterans representatives at the ground level have been doing a great job of connecting our veterans to their benefits locally when some of that lacks, and hopefully support of that program will be able to maybe even help make up some of the difference. But thank you for lifting up that issue, Sergeant Major, for your service and for what you do.
Thank you. And if I may, there is controversy out there in conversation, social media, et cetera, that veterans are abusing the system. And credit is due where credit's due. I would offer to you that 10, 15 years ago, the VA did a bad job at communicating with our veteran community. In that matter, we were not providing them the education to how to access and what benefits they had access to. Over the last 10 to 15 years, the VA has done a great job at making that connection with the veteran community to increase their awareness, which increase usage of benefits. And that's why I think it's a misconception that veterans are abusing the system, because there's more using it now. And I would hope you guys remember that when you're getting at benefits for the state of Connecticut veterans.
Roger that, Sergeant Major. I can personally attest that I agree very strongly with that situation. Most soldiers don't need a handout, just a handout.
Absolutely. Thank
Well,
you.
Thank you, Sergeant Major.
Any other questions? Well, thank you so much for joining us today. We really appreciate it.
Thank you for
Um,
the opportunity.
I don't see Mr. Lewis, so I'm going to, without any, hearing no, I'm going to adjourn this meeting. Thank you so much for joining us today, everyone who joined us. We appreciate you. Take care.